afternoon. Christina Lau, USAID Milan.
Kimberly Cole, USAID Milan.
Jody Waldron, USAID Malawi.
From Pastor Boys Association.
Amos Amanga. Sikizani na kweli. This is what most of the story.
What is also called by NBC?
Hapo jitengo kwa
All the ITC translated.
sisi ya kwa tumeendana kwa
Thank you very much, everyone, for the introductions. Guest of honor, Your Excellency, just to mention that we are beaming live on Luntha television, so a lot of people out there are actually following the discussions in here on TV. Next, I would like to call upon Mia to bring to us the objectives of the session this afternoon. Thank you.
Good afternoon, Your Excellency, our guest of honor, and all protocols observed. The Interfaith Roundtable discussion organized by the Ministry of Health in collaboration with Breakthrough Action Malawi, World Relief, the SCOPE project with support from USAID. It has strategic interventions to reduce vaccine hesitancy, to improve uptake of and promote adoption of positive behaviors among eligible populations in Malawi. Religious leaders are key in managing perceptions, misinformation, and rumors on COVID-19 vaccines. The objectives of this meeting are to appreciate the efforts by religious leaders and their leaders to create demand for COVID-19 in the communities, to discuss creative ways to engage the faith communities to share information on COVID-19 vaccines and how to encounter rumors going around. Thank you very much, Your Excellency.
Thank you, Madam Leferankande, for the objectives of the session. I hope we are now moving together. We are happy that the country's leadership is actually also in the forefront when it comes to COVID-19 response, and this is why we also have the Presidential Advisor on Religious Affairs here. May I request Reverend Brian Kamwendo to come and say a few remarks. Thank you.
Guest of honor, Honorable Kumbize Kandodo Chiponda MP, Minister of Health, Your Excellency Ambassador David Young, the Director of Administration, and the World Health Organization representative, Dr. Ambo, here present. and bishops, my Lord bishops, moderators, general secretaries, founders, reverends, imams, sheikhs, and all the evangelists here present, and all protocol observed, ladies and gentlemen. I stand here this afternoon as an ambassador of the faith community within the state, just in the first place to appreciate you guest of honor, especially because of the role that you've actually played as a ministry in making it a point that you've also placed the faith community as a key stakeholder in terms of managing issues to do with perceptions, but also even misinformation. Allow me to indicate that we are highly appreciative, especially because of what has happened so far. Your ministry has been considered as one of the ministries that has made it a point to make it as a very good collaboration, even as we think about our role as the faith community. 98% of Malawians have got a certain believing aspect. So in this nation, demographically, it's only 2% of those that are not believers. And yet the faith community at times has been sidelined. But we would like to appreciate that we've observed a very good collaboration as far as the faith community and government is concerned. To this end, I would like to appreciate so much. Maybe just to cite some samples within these few minutes is that if you recall, guest of honor, it's your ministry that had made a recommendation even to the National AIDS Commission at that particular time for us even to have Archbishop Dr. Ben Malango to be the chairperson of NAC, if you remember very well, during those particular moments. It was a critical time in which AIDS was a very big issue in this nation, and yet you appreciated and you made the faith community to chair that particular organization within the state. Not only that, but recently, even under COVID, we've also observed, guest of honor, even yourself, you've also taken a deliberate initiative when you were talking about the presidential task force. Some other days, instead of you making a statement, you've actually been calling upon the faith community just to come and pray and encourage the nation. We don't take this for granted. Not only that, but the demonstration of the same is also indicated when we do have a place as a faith community in the presidential task force. Representing us is Monsignor Patrick Tawale, the chairperson of Public Affairs Committee, which indicates that the faith community is indeed something that we have to go by, even as we think about collaboration as we move on. Recently, the cholera outbreak. The ministry has also made it a point, under your leadership, to make it a point that even the faith community has been involved. So I would like to appreciate so much, especially because of what the ministry has been doing. Not only that, but also to appreciate the faith leaders here present, that you've actually responded patriotically, even as far as these demands are concerned. Guest of honor, I just wanted to speak on behalf of the faith community that there are some other times in which we've actually been calling our meetings high level, only to discover that the moderators, the bishops, the founders, the general secretaries and others are not there. But today I deliberately came to support you, guest of honor and your excellency, just to indicate that this meeting today is indeed high level. Now, when we are talking about the faith community, we who are within the faith community, when we say Malawi has gathered as far as the faith community, there's no way Malawi can gather as far as the faith community is concerned when you don't have the bishops, when you don't have the founders, the apostles. That particular aspect of the meeting, without the bishops, without the founders, the apostles, the moderators, the general secretaries, Malawi hasn't met yet. But today, Malawi has met. So without much ado, guest of honor, I would like to appreciate you so much, and also this afternoon allow me on behalf of the faith community to welcome in our community, because most of the people do not know that His Excellency Ambassador Yang is also a pastor, is also a minister of the gospel. So allow me to welcome Abusa, Abusa Yang in our fort on behalf of the faith community in this particular nation. Thank you so much for your attention.
Thank you so much, Reverend Brian Kamando, Presidential Advisor on Religious Affairs. Now, right from the outset of the COVID-19 response, we've had a lot of support from the American people, and therefore I would like to call upon the American Ambassador to Malawi, Ambassador David Young, to also come and say a few remarks. Thank you.
Minister of Health and Population, the Honorable Kumbiza Kandodo Chiponda, MP, the Presidential Advisor on Religious Affairs, Reverend Ben Mwana Piri, the Chairperson of the Public Affairs Committee, Monsignor Dr. Patrick Tawali, the WHO representative, Dr. Nima Kimambo, senior faith leaders, apostles, sheikhs, bishops, pastors, imams. It's a very holy place. Members of the press, distinguished ladies and gentlemen, good afternoon. Moni nonse, muli wuli. And should I also add, Mbuye Akurulitsene, Salam alaikum. God bless you all. It is such an honor to be here for this very important event. I am here today wearing a couple of my hats, as I have pointed out to several of you before. Because on the one hand, I've been a diplomat for 33 years, but for 35 years, I have been a faith leader myself, an ordained minister in my church, the Methodist Church, and have been very involved with interfaith dialogue in many countries around the world, from Nigeria to Zambia, with people of the book, and I have valued greatly the conversations that I have had on important issues of faith and political and economic issues. I very much am humbled to come together with you today to engage in discussion about these important issues of our shared commitment to the people of Malawi. I visited a number of you at your churches and houses of worship, and I look forward to other engagements at churches and mosques around the country. So I look forward to a continuing dialogue as a person of faith myself. We come together at a time when people across the country and around the world are faced with incredible challenges. Over the past 2.5 years, our lives have been turned upside down by COVID-19. A few months ago, I joined the family of one of my colleagues from the U.S. Agency for International Development to celebrate a man named Martin Matika as we honored his life and legacy and unveiled his tombstone. Martin was a proud father, an amazing colleague for 20 years at the USAID, and a friend of so many of us at the embassy. He dedicated his life to helping prevent the transmission of infectious diseases like HIV/AIDS. And his legacy includes hundreds, if not thousands, of Malawians who are alive today because of his personal dedication and efforts over 2 decades. Now, sadly, Martin passed away from COVID-19 in January of 2021, just a few months shy of vaccines becoming widely available. Now, many of us have lost loved ones because of COVID-19. And they are people that we knew, we loved, we relied on in our houses and communities of worship. And they're people like Martin, who lived lives full of purpose and hope, faith and love. They had families and they were part of families. They had dreams and they loved and prayed and they helped others. They were cared for by countless doctors and nurses who worked tirelessly to save their lives. Now today, we have reason for hope. And hope is so important in faith. My tradition says that there are 3 great virtues that we have: faith, hope, and love. And we have to hold on to hope. When I was a young man years ago, I'm still young David, but when I was a younger man, I once heard a great American preacher speak a dynamic speech sermon where he talked about keeping hope alive. And that's what we need to do together. Because as faith leaders who have so much influence and impact on your flocks, on your congregations, on your mosque, your communities, your churches, you have tremendous influence. And you have the opportunity to help keep hope alive. Now, we keep hope alive by efforts that we make to save lives as well. So the government of Malawi has led a massive coordination and mobilization effort to keep hope alive in the fight against COVID-19. And this has resulted in significant health and social benefits. Since its peak in Malawi in January last year, the number of deaths from COVID-19 has gone down dramatically, while the capacity of the health system to respond to complex emergencies has increased. So we are once again able to come together in classrooms, in markets, in our places of worship, in a gathering like this. Do you miss masks? I don't. We don't have to wear them because of vaccines today. They've changed our lives. We are once again able to come together in classrooms, in markets, in our places of worship, and we know that COVID-19, it's still with us. It still is taking lives, but very few compared to before. Because we have now more tools to keep ourselves, our families, our faith communities, our parishioners alive and safe from the worst impacts of this disease. Now, one resource that's available to us right now is the COVID-19 vaccine. I won't ask you to raise your hands, but I'll raise my hand. My whole family has had the vaccine, and we haven't lost anybody in our family despite COVID-19 raging across the United States. That's the reason. COVID-19 vaccines save lives. You know, since March of last year, the Ministry of Health has vaccinated almost 4 million Malawians, 1 out of 5 citizens in the country. That is an incredible achievement that needs to be applauded. We need to go further, but we are proud as the U.S. government to support this effort, and we've contributed more than 55 billion kwacha to fight COVID-19 in Malawi in partnership with the ministry and our colleagues here. And we've contributed 3.5 million COVID-19 vaccines. You know, people who are vaccinated are less likely to contract COVID-19, and if they do, they are much better protected from serious illness and death. The more vulnerable among us, especially the elderly and people with other health conditions, are especially encouraged to get vaccine boosters to increase their protection. These vaccines are safe, effective, and help to save lives. I've had 4 jabs, the 2 shots from Pfizer and 2 boosters. Now, my team at the embassy, the health team, told me I was 60, so I was one of the elderly. Now, that took a little bit of getting used to, Apostle, because I think I'm young, David, but if I'm elderly, I'll get the jabs. But I think the key point is that we need to promote these life-saving vaccines. We get vaccines for other diseases, don't we? Smallpox and the other kinds of vaccines. We get flu shots and other things. But there's been so much misinformation about this particular vaccine. We've lost lives because people don't know the truth. And that's where you all come in, because you're truth tellers. You speak truth and truths to your congregations that are powerful. And what's more powerful than those life-saving messages that you can share with your believers? I really challenge all of you in this conference to think about how you can take these life-saving messages back to the people who look up to you. They admire you, they revere you, they respect you. You have tremendous impact on people's lives, and that's why we're having this conversation today, because you have impact on lives, and you can help save lives. So we want to emphasize that these vaccines are safe, effective, and they help save lives. Honorable Minister, I want to thank you for the incredible commitment your ministry has shown to saving lives of Malawians. Over the past 2.5 years, your frontline health workers have been nothing short of heroic. And today you're battling cholera. You're battling other diseases on top of HIV/AIDS and tuberculosis and malaria, the other challenges we face on health. And I want to applaud the faith leaders who have joined us here today to bring your voices to bear, to have an impact for good, to provide Malawians with accurate and reliable information. Encouraging our brothers and sisters to become vaccinated is an act of hope, faith, and love. And those are powerful, powerful things, according to our faith traditions as people of the book. Those are things we believe in. The United States has been a steadfast partner in the battle against HIV and COVID-19 in Malawi. And we will continue to partner with you and with the people of Malawi to end the COVID-19 pandemic, to mitigate its devastating social and economic impacts, and to build back a world that's even better prepared for future outbreaks. Together we can save lives and support the healthy population at the heart of Malawi 2063. So I want to thank you for coming. Thank you for your commitment. And as I've said in some of your houses of worship, I thank you for what we do when we walk out the door. Because we come together in fellowship and resolve, but what matters is that faith expresses itself in works. Because faith without works, my tradition tells me, is dead. So I challenge all of us to work on that front, to move forward together. Thank you very much. Shukran. Zikomo Kwambiri.
Thank you so much, Your Excellency. Now, ladies and gentlemen, very shortly, the guest of honor will be officially opening the discussion we are going to have this afternoon. I would like, therefore, to call upon the Director of Administration, Mr. Benimbwana Piri, to come and say a few remarks, and then invite our guest of honor to officially open the meeting.
Our guest of honor, Honorable Kumbezeka Ndodo Chiponda, MP, Minister of Health, the U.S. Ambassador to Malawi, Your Excellency Ambassador David Young, the Presidential Advisor on Religious Affairs, Reverend Brian Kamwendo, all religious leaders present here, directors and deputy directors in the Ministry of Health, representatives from MIA, PAC, World Relief, Breakthrough Action, and UNICEF, members of the press, ladies and gentlemen, all protocols observed. Honorable Minister, my humble duty this morning is to request you to address the gathering here and to officially open this meeting. And I'm doing that on behalf of Secretary for Health, Dr. Charles Mansambo, who could not be with us for other reasons. But before I do that, Honourable Minister, let me thank you sincerely for the leadership that you have continued to display in the ministry. As Ambassador Young has explained, you are leading the ministry at the time that we are facing a lot of challenges. COVID-19, we have polio, we have cholera, and this is in addition to all the other diseases that we still have. We still have malaria, we still have TB, we still have HIV/AIDS, and many others, NCDs. All those, unfortunately, Honourable Minister, the ministry and the sector that is leading this is the Minister of Health and led by yourself. But I must thank you so much that you don't tire. You have continued to be with us. Yesterday night, you were here at BICC with your fellow ministers, where you were trying to strategize on how we can go about with a cholera fight. This morning, you were here at the BICC opening a meeting which is talking about improvement of quality in the health sector. As we know that to deliver services that can help the people, quality, we can't take it away from it. And that is in addition to the fact that you are attending Parliament. And for all that, Honourable Minister, we don't take for granted. It just shows, it's just a manifestation of the commitment that you have towards that sector. This meeting is yours, high-level meeting with top-level religious leaders. I'm not there to make a speech, and therefore allow me to request Honourable Minister to address the meeting, but also to officially open. Thank you.
Thank you so much, Mr. Benimbwana, who is our director. We're responsible for administration. Ulemu, ubide kwa Ambassador David Young. Your Chiche was becoming much, much better every day. I think we're covered about so zina Chiche wangu kala fumwe age kapena abusa ndani ka abusa pili tufuna zina tukupatseni ulemu advisor president Reverend Brian Kamwendo. My directors atose amene mwachoka kunduna za moyo Dr. Nima Kimambo, thank you so much for gracing the occasion. It is an honor for us to have you this morning. Azibusa tuosiana siana ambuye kumeneko lero ndenda dalatu anthu ose osowa ambewe ndakuona ni tsiku lija mudalalikira pakamuzu day. You blessed us so much. Thank you so much. Zikomo kwambiri abusa akachipapa zikomo mulimo muno timakupera ni mama uli wose 5 koloko linga lathu la lero mmatidalitsa. Zikomo kwambiri nonse popezeka pano mashehe zikomo kwambiri ambuye akudalitseni nonse. All interfaith groups who are here, especially the organizers of this very, very important function. Thank you so much. We do not take it for granted to have organized such a blessed function. The function, they have explained the objectives of this function, but to me, I see a hand of God, because I've been thinking, I said, God anthu amene aja ningapeze bwanji kuti tikape nkhani yakolera makolo anga muli apa ndimalakalaka muntimamu ndimati kodi tipange bwanji koma chimandivuta inali nkhani yakolera osati ya COVID. Chifukwa ya COVID ndiona kuti ndithu tidali ni mpata waukulu umene tikakhala ndithu mamiting angapo ukambirana nkhani ya COVID kodi titani kuti titani. Nose munagwapo, mipingo yose munagwapo, utithandiza ife kugula mamaski kutani, machalichi, mamoski mosemu, wiki ndi wiki, weekend ineli yose, anthu amapwa nkhani ya COVID. Ndipo nchifukwa chake pano tukamba kuti ayi koma Malawi Mulungu anatikondera. Chifukwa matuka muonera pa filimu zimene zimachitika kunjako, anthu mmene amafera. Tsono ine mati kodi nanga tikafika kuno, poti zipatala zathu zochepa, zikhale bwa. Koma chifukwa inuyo munatengapo gawo lalikulu makamakaso gawo lopempherera. Chifukwa ine ndimati Mulungu amene anatipulumutsa ndi Mulungu kunjako kuti ali ndi zipatala ali ndi china chilichonse koma anthu nkumafa ankhani miyanda. Kunoko azibale athu adapitadi oposa 2000 chakuti adamwalira. Komabe Mulungu anatikondera kwambiri pa nkhani ya mliri wa COVID. Ndechifukwa chake ife akunduna za moyo timayamika kwambiri faith community. You are a blessed partner to us. You partner us, you assist us in so many ways, apart just from praying for the whole country, but you also assist us. We have charm hospitals being run by the faith groups. We have training schools for nurses, for clinicians being managed by faith groups. So you assist us in so many ways. You are our counselors. Matenda yena safunika so mankhwala olofeso kuchipatala akafika pajapoti tanjuda nawo atimati pitani kwa abusa. We know our limitations as a ministry especially in the health sector, we know our limitations. So sometimes we reach a point where this patient, we know that we have tried all our best, but we are not achieving anything. We know what we need: divine intervention. We take them to you, our sheikhs, we take them to you, my bishop atu, azibusa atu, timati igwamponi, because we know that you have powers higher than the ones which we have in the ministry. So for that, we are really, really grateful for the very important role which you play in Malawi, especially in the health sector, and we are so grateful. We have service level agreement with most of the CHAM facilities for providing services, maternal services especially, to the women and also to the children. And now we have also included the cholera. So I will dwell on the cholera issues because that is the issue which now we are struggling with. Zakovidi Akambapo, Ambassador David has talked about it. Abusa Agamwendo, I am also organizer also, and I am Zakovidi. Nkani ni olimpiki sana katemera. Malawi muno niyese aliyese pano ndithu idamu fikapo kuti tunena kuti tukoti muliriwu mankhwala mpaka na pano sadapezeke. Tukamba pano mankhwala odukadwala uchira sadapezeke mpaka na pano. Chiyembekezo chokha chimene chilipo ndi nkhani yakatemera. Chifukwa chake ifeyo ngati boma mothandizana ndi azathu amene timagwira nawo ntchito mapatina zathu makamaka World Health Organization, USAID, osiyana-siyana, UNICEF, pothandizana pake tidabweretsa katemera. Pano dokamba pano ku Malawi tili makatemera onse, tili ndi Pfizer alipo, tilinso ndi Johnson & Johnson alipo, komanso tili ndi AstraZeneca. Komanso malamulo paja masiku ano tidanena kuti vana akangokwana zaka 12 ayi ndithu zabwinobwino kalandira katemera, pasakhalenso ankhawa kuti akadwala akakatani ayi amakhala bwinobwino. Ndikuthokozeni ambuye, I think ambuye Atambala adali nawo adakabaisa nda president kuzomba State House ya kuzomba paja tidasandusa chipatala. Ambuye anali nawo ndi anali oyambirira kufuna kuti ndithu anthu abapasa chithunzithunzi chabwino. Mosu Tawale atithandiziraso kwa basi kunoko nde amachitotitana kumaula ino akunduna zamoyo bwerani kumaula anthu akangotuka mchalichi amapesa tili panja tikuwabaya ma-services amenewo akadalipo ndithu. So ndikupempheni ni mashehe athu, azibusa athu, chonde mapastors osiyana-siyana ngati muona kuti mwina anthu amatangwanika, we can bring the vaccine to the people, to the churches. Those services are available to you. Tiuzeni ife tibwera kumeneko cholinga tifuna kuti amalawi tatetezele pajazima tifuta January, this is November. This is the right time for one to get the vaccine. Ikafika ikadia Christmas, ikafika January, nde manambala athu amazambo kwera zinthu zimativuta. Tsono amati uthola khobwe ndi mawa pano nde nthawi yabwino yoti anthu alandire katemera wa COVID-19. Matenda akadalipo sadate. Dziro lindi maona tinapeza ka 90 ujeni tilindi makesi kanda about 20 makuka mathumu nangasiwa COVID sunga mudziwe palibe, you can't tell that this person is COVID positive. So we just need to protect ourselves. We still have the virus amidst us. Last night we had about 20 active cases amidst us. So it means the risk is still there. Tinavutika machalichi kuvutikira anthu anavutika. Anthu ufuna kapemphera kumana ngapita bwanji chintenda chimenechi chinasautsa pena palipose. We have lost our Muslim brothers, we have lost our Christian brothers and sisters as well. Everybody else was affected. Aliyese palibe amene angati chinamusemba hayi tose tinavutika. Ndiye tunena kuti we should not get back to that stage where everyone else suffered. Our churches suffered. We suffered greatly. Our economy suffered greatly. Our businesses suffered. Inutu mukavutika ndio tifeso boma lavutika. Chifukwa boma tilibe bantu. Tikamati fendi fotumikira anthu amene timatumikira ndi anu amene amakhala m'machalichi mwanu, amene amakhala ku mosque. Those are the people we serve as government. So that is why it is our responsibility that we engage with the faith community so that we provide a hope to the people of Malawi. And for the COVID-19, our hope is in the vaccine. So we want to encourage you. You have already done so much in assisting us in spreading the message of the COVID-19 vaccine. There was a lot of misinformation, disinformation, a lot of, fake news. Mugadere simbereka, mugadere simbereka, tere. Pambiriso baberekaso panoso ololi ndi mimba, you can still get the vaccine. Wamimba rede timampasa katemera. Amakhaso bwino oberekaso mwana wa mphamvu waters. Chifukwa analandira katemera wa COVID. Ndiye utenga walero makolo athu nkonena kuti tithandizireni katemera kadalipo. Pamafunika kuti tikamafika pano tili mwina pa 60%, amalawi mwina ka 9 million atabaitsako olo 10 million atabaitsako. Tsono paife tokha sitingakwanitse tidalira inu kuti mutitengere uthenga umenewu wakatemera wa COVID kuti chonde amalawi tofunika kuti titetezane wina ndi nzake kumuliri umenewu wa COVID umene ukadalipo ndithu kusonyeza kuti aliyense adakali pa chiopsezo. Titengepo mwayi kuti tikambeponso anakambapo ambassador David Young kuti pano tavutika ndi muliri wa kolera makamaka amene tuchoka ku Lake Shore kungambira kukalonga uko kumatsetsereka kalonga rumpi kudzafika kunkhatabe uyo udzafika msalimamu mangochi machinga tavutika amene mafika dzulo anthu 262 amene amwalira ndi kolera kumalira ndi kolera anthu a Mulungu. Kolera ya ndithu ali m'midzi mwathu m'matchalichi mwathumu kolera wavuta kwa basi. Ndiye tifuna kuti mutithandizire. Kolera ndi nkhani ya ukhondo. It's just about hygiene. Ukhondo kuti kodi ukhondo utitani ndeti kupempheni ino azukulu athu amene ndithu makumana ndi anthu amene wa wiki ndi wiki tithandizireni uthenga umenewu kuti kolera ndi nthenda yopeweka kupewa pake basi ndithu kumasamba manja kugwiritsa ntchito madzi abwino. Tikudziwa madera athu ena ndithu anthu akadamwa abwemuna kuzithapwi sikuti mkose ali ndi mijigo zimenezo tuzidziwa ndithu koma tiye tapasani chilimbikitso ukangophika madzi wajo watenga kuchithapwi kungophika basi tu ukachilombo kwakalera kamafa nkophika zedi kamadana ndi moto kuopsa ndiye kungophika kamafa olo zakudya tizidya tikareti anthu azidya zakudya zophika azidyaso zili zotentha tiapange discourage zongotola apa ndi apa achoka kutchali chimuse umo basi aniguleko kachani panopa tente apange discourage chifukwa iwabwera vula ndoti zinthu zisokonekera zikasokonekera ndoti tonsefe zitisokonekera kumalawi kuno sunganene kuti yaza gwa mudzi mwakuti basi ife titere pomwe paya idayamba munthu mmodzi tikumachenga malichi munthu mmodzi weniweni kena kwa awiri kena kwa atatu tikamba pano anthu mwina 8000 chakuti adwala kokolera imangofala pang'ono basi wina wapita ku nyanja ankafula kosomba kungoja umeneko afika pa mudzi pako ndoti wabweretsa kolera pamene poponso ndiye kuti basi anthu ogwira nawo manja wadya nawo mbale mmodzi watantani ndiye kuti yafala kolera imapha within hours ukangwamba kutsegula kusaza muja ndithu mpaka na munthu kufa. Ndiye chonde tithandizane ife ngati kunduna za moyo we are doing our part ndithu mbali athu tuyesetsa uthamanga kuonetsetsa kuti mankhwala aliko zipangizo zonse ziliko kuyikaso matenti apa ndi apa chifukwa odwala kolera amafunika azikhala pa okhaokha asakhalenso ndi anthu ena olo mapatient ena nchifukwa chake timayesesa kuti tipereke matenti kuti tizathandizira anthu amenewa. Koma china chimene chutivuta nchonena kuti chifukwa cha zikhulupiriro zathu zosiyanasiyana zimenezi zikutipweteketsanso. Wiki iyo tidapita usalima I was with Dr. Nimba kupita kumeneko kumene tisungira anthu odwala kolera. Ukafika kumeneko kwa madokotala ndithu akudandaula kumeneko ndikuti inu kamwana akabwanji napeza kamwana aka miyezi 9 bwana uyu bwanji kolera amaka ali kuti ali kunyumba atatoka ali kuti ali kunyumba chaka chachitika nchani akuti ayi onse awiri amapemphera chai choti imakaniza kuti azipita kuchipatala ndiye afumu anachitopita nkukamuba mwanayo kuti adzalandire thandizo kamwana katafokera anthu kakusaza akakutsegula. Zono zikhala bwanji akuti ayi amanena kuti ku mpingo wawo tisamayike drip. Zono mwana wafoka wasaza watsegula wafokeratu oti chongofunika ndi drip koma chifukwa cha zipembedzo zosiyanasiyana zikhulupiriro zosiyanasiyana. Zono nkhani ngati zimenezi zonena kuti ndithu ngati ife boma mwina kuthekera kwathu kutokhalira pocheperapo koma inu azibusa atife mafika pena paliponse komanso ndipo anthu ama society respects the faith community so much more than even politicians. Our citizens, they respect the faith leaders. They respect you so much. They listen to you. You command so much respect in the society. That is why as government we rely on you that whatever messages which we are giving to the Malawians, you should help us to give these hopes these messages. These are messages for us to curb this cholera outbreak. We need your involvement. Help us in your church, in your mosque, wherever your faith is, your believers are meeting. Please take the opportunity to spread the message of cholera. Yavuda tose sitingasangalale ayi. Komanso ngati sitisamala ngati dziko ikamafika January sinthu zoti zikhala bwanji chifukwa vula ikabwera mpamene kolera imavuta. Nyengo zasintha pano nthawi yotentha koma kuli muliribe wa kolera. Soneza kuti zinthu zidasintha ndiye zinthu ngati zasintha, it is our responsibility to respond to it accordingly. So I'm making an appeal to our faith leaders. I'm so blessed today, and thank you so much, our organizer, Reverend Brian. Thank you so much, you said through you, Ambassador, for organizing this wonderful function. And thank you so much for inviting me, because really deep down my heart, all this past week I was thinking, how do I even get our faith leaders together? Where do I even start? Now I'm busy with Parliament, but God works in a mysterious ways. And I'm a believer, so I believe that God works in a mysterious ways. That this afternoon I have an opportunity that all of the people who I was looking for, I mean, lelo ndangopesana nawo gululu muno mu BICC ndakuthokozani kwa basi zikomo. And thank you so much for responding in a very positive manner. This is what we need as a Malawi to move together. Government ife mwadika pamenepo kuti tikutumikireni. Koma funika kuti tose tizendera limodzi chinthu chiti chinyamulire limodzi amati kwathu tsindwi loti laola umafunika kugwirizana chifukwa chitha kukugwerani nde wina amagwera konayo wina konayi nkuchosa tsindwi limenelo ngati tifuna kuti tilikoze nchimodzimodzi mafuwa kuti uphike sima amafunika mafuwa atatu sungangokhala moto ayi mafuwa atatu oti agwire budu. Sono ifeso boma ngati government ife executive ndife fuwa lina, faith ndi fuwa lina, ukukwena kukuli our traditional leaders fuwaso lina, koma tosefe tutumikira anthu ake amodzi, anthu ake Malawi. Ndeti kuyamikeni kwambiri kuti ndithu mukabva kuitana mmasiya zonse ndina anthu amabize. Ambuye mulima bize timikira mapalisha akuluakulu azibusa athu mipingo ikuluakulu mashehe athu ndina anthu abize mwachokaso kutali. So we don't take it for granted when you respond in affirmative when we call you. It shows your commitment, it shows kuti inunso dziko lino ndithu mmalika pa nambala 1 kuti mutenge nawo gawo lotumikira Amalawi. Chifukwa cha chimenechi ife timakuthokozani kwambiri. Ndisakutayireni nthawi yathakale kwa maonda amenewo kuti zikomo. We depend on you. Timakudalirani. You are our trusted partners, not just in the Ministry of Health, kwa education, kwa agriculture, kuti koseko timakhati limodzi. Koma most importantly, we thank you for praying for this country, Malawi. We only have one Malawi. It is our responsibility, all of us, to pray it, that things get better for Malawi, indeed for our people. Ambuya kudaliseni nonse zikomo kwambiri.
Zikomo kwambiri mlendo wathu olemekezeka komanso omwe ndinu nduna ya zaumoyo tikuti zikomo kwambiri. Mlendo wathu olemekezeka nduna za umoyo Mai Khumbize Kandodo Chiponda MP komanso kazembe wa boma la America kuno ku Malawi Bambo David Young, mlangizi wamkulu pa nkhani za chipembedzo kwa President Abusa Brian Kamwendo, omwe mukuimira mulembi wamkulu mu nduna za umoyo Bambo Ben Mbwana Phiri komanso akuluakulu onse amene achokera ku ndunako, mkulu wa bungwe la Brecho Mai Dr. Nima Kimambo komanso mabungwe osiyanasiyana amene tugwira ntchito za umoyo kuphatikizapo kulimbana ndi matenda a COVID-19 pompano wapampando wa bungwe la PAC Monsignor Patrick Tawale komanso onse amene mwabwera nawo, komanso wapampando wa board ya MIA Reverend Clifford Matonga ndi onse amene akuperekezani, magulu onse yanasiyana azipembedzo omwenso muli pompano, atolankhani amayi ndi abambo. Pamenepa ndiye pa mtsiriziro pa gawo lotsegulira msonkhano wazokambirana kuti akuluakulu azipembedzo zosiyanasiyana tili ndi gawo lanji kuti tionjezere chidwi pa katemera wa COVID-19. Tikudziwa anduna kuti mukuthamangiranso ku parliament mwatikomera mtima kuti munali nafe, koma timafuna tingopempha poti mwambowu ndi wamtengo wapatali, tingokhala ndi chithunzithunzi, titole chithunzi ndi akuluakulu amene abweranso panjapo, kenako tipempha kuti muchezeko ndi atolankhani kuti amalawi kunjako ambiri amvetseso za zimene zikuchitika kuno. I would like to request you, our guest of honor and the high table and the rest of us, for a group photo outside there, because this is a momentous occasion. And then after that, we'll allow for media interaction with the guest of honor and the other delegates that may be required. After I'm advised we're going to have the group photo just here, which will make us save on time. Thank you so much. So after the group photo, we'll go straight into media interaction. Thank you. May I request the high table to
Luntha Television, bringing wisdom into your home.